Today we're here to discuss the eVox Brain Interface Assessment and Training System, or BIAT system. The system comes complete in a convenient carry case containing all the components required to perform the brain and heart measurement as well as biofeedback. The components required for patient preparation come on top of the kit. Underneath is the laptop with preloaded software to run both the measurement and the biofeedback. The kit comes with 2 cap sizes, a large blue cap, as well as the red medium-sized cap. There's the eVox amplifier, Bluetooth wireless amplifier device. The cap plugs in the front. There's a power switch and a charging area. Earbuds for the patient's audio stimulus. Hypoallergenic medical tape for applying the ECG lead for the electrocardiogram. A patient response button with a USB connector for the computer. A charger with universal adapters for international use. A measuring tape for measuring the circumference of the patient's head to get the correct cap size. Gel for applying in each sensor to improve the connection in the cap. Exfoliating new prep to prep the patient's earlobes for better contact on the references. And all the disposables required for performing the test, including blunt tip needles, alcohol swabs, and a syringe. That is the complete kit required to do the BIAT assessment as well as the BIAT biofeedback. We're now going to perform a demonstration of patient setup. I've laid out the components from the kit that are required. We have the new prep, the measuring tape, the gel, the hypoallergenic tape, alcohol swab, a new blunt tip needle, the syringe, the cap, the amplifier, the patient response button, and the earbuds. The first step is to put gel in the syringe. I take out the end, I squeeze in the gel to just over half full. I insert the end back in. I open the new needle. And attach it to the syringe. This is the syringe and needle. The needle attaches simply by screwing it on. Note that this is a blunt tip needle, the large hole in the end, simply for applying the gel in each hole in each sensor. Use an alcohol swab on the patient's earlobes, the site where we would put our reference electrodes. And I would wipe down the forehead to remove any excess makeup. At this point, I will measure the patient's head using the measuring tape. In this case, we are 54 centimeters. You can note the size of the cap in the label in the back. 54 to 58 centimeters is a medium-sized cap. At this point, I will place the cap on the patient's head. It's a ribbon cable, which which will attach to the amplifier. The 2 dots go in the front of the head, the label in the back. I will place this just over the patient's eyebrows. I will ask them to hold the cap in place, and I simply pull the cap back over the patient's head. Okay? There we have it. Coming from the cap are 3 wires. 2 references, which go in the ear, and 1 ECG lead. Okay. I attach the cap to the amplifier. And I turn on the amplifier using the power switch. I note a flashing blue light indicating that power is on. The amplifier can be on the desk, or it can be easily clipped to the patient's clothing. At this point, I'm going to prep the earlobes using New Prep. I'll apply a small amount to a Q-tip. Lightly prepare the earlobe. Open the ear clip. Insert gel. And apply the ear clip. For the ECG lead, we want to ensure that it's on the left side of the body. We will use an alcohol swab to prepare the area either just below the collarbone or just above the collarbone. Prepare the area. Fill the ECG lead with gel. Tape the lead to the prepared area. An alternate positioning, once you've determined signal quality, is to move the ECG lead to just behind the clavicle, which may improve your signal. You can determine your signal once the software is running. At this point, I will launch the software, input the patient information, and click through until I get to my contact quality screen. Upon reaching the impedance screen in the software, we will begin to insert the gel inside of each sensor in order to get better contact quality. We will start with the ground sensor, which is the most forward sensor in the cap. Place the needle through the hole, pull it off slightly, squeeze in enough gel that some comes out of the hole, and then move the hair and move the gel around so it fills the cavity. As I'm doing this, I'm watching the impedance screen. It will go from red to yellow to green. When it reaches green, I have a good contact, and both of my ear sensors will also turn green. At that point, I move through the sensors. After completing all sites and referencing my impedance check, I go back to any sites that are still red or yellow, and I simply add a little bit more gel and improve the connection. During this time, watch for wires that may be underneath a lead, and simply move the lead so it's not impeded by the wire. Apply your gel and continue. Once complete, you want to ensure that the patient's earbuds are in each ear. There are right and left indicators. And at that point, patient setup is complete, and you can continue on with the software program. This screen is an eye blink demonstration. This will be displaying the patient's real brainwave activity. You should check for the signal quality in all of the EEG leads, and as well as in the electrocardiogram along the bottom. When the patient blinks their eyes, They will see that blink indicated in the EEG, most notably in the frontal leads. There's an eye blink. Press the response button to continue. Here we demonstrate muscle activity and how that interferes with the signal. We ask the patient to clench their teeth, and you will see the EMG, or muscle activity, indicated in the EEG record. Here is a demonstration of the EMG activity. Press the response button to continue. It now indicates 3 parts of the test: the eyes open, the eyes closed, and the reaction time test. Each test will demonstrate how many minutes will be in the test. In the real test, in the clinic, you will have 5 minutes, 5 minutes, and 10 minutes. Press the response button to continue. This indicates the eyes open test will begin. Ask the patient to relax and focus on the screen during the test. Press the response button to begin the test. A countdown every minute will be indicated on the screen. In the clinical setting, it will begin with 5 minutes. At the end of the test complete screen will come up. You can either repeat the test, or you can press the response button in the patient's hand to continue. Closed relaxing test. Ask the patient to close their eyes and press the response button to begin. A reminder to keep your eyes closed will come on the screen.
The eyes closed test is now complete. You may open your eyes.
Audio instructions will indicate to the patient when the test is complete, and they will be instructed to open their eyes. They can press the response button to continue or repeat the test. The reaction time is the last test. Instructions come up indicating to press the button on a large circle. They press the button to continue. When they see a small circle, they are told to ignore it, and then it indicated to press the response button to see the next instruction. When they see a checkerboard, they're instructed to ignore it. When they hear the sound play, they're told to ignore the sound. They can either repeat the instructions or press the response button to continue. They're told that they will perform a practice test. They are reminded to press the button to the large circle and ignore the small circle. They press the response button to begin the practice test. The practice test shows the stimulus that will be used during the real test. During the practice test, they receive feedback whether they have a correct response or an incorrect response. The practice test is 1 minute. At the end of the practice test, they're provided their scores of how many correct presses, how many missed presses, and how many wrong presses occurred. If the practice test is failed, then they are told to repeat the practice test. They press this button in the bottom left to repeat the practice test. They then receive the instructions again. Press the button on the large circle, ignore the small circle. Press the button to begin. Upon successful completion of the practice test, or after a second attempt at the test, you proceed to the real test. They are reminded that during the real test, you will not be informed of whether your responses were correct or incorrect. They press the button to proceed. Even if the reaction time practice test was failed twice, you can proceed with the test as you still receive valuable information on errors of omission, commission, visual processing speed, and auditory processing speed. At the end of the reaction time test, the notification of the test being completed arises. The patient can press the response button to continue, that the testing is complete, and to leave the computer on and connected to the internet for 30 minutes to allow the data to be uploaded to the servers. Press the button to continue, and you return to the login screen.